Hello, good evening, everybody. How was your day? Happy New Week to you all. It's another beautiful evening. My God, cheers, spreading mamas, the nursing mom, all the women. This evening topic is about breast engorgement. Breast engorgement. It's a very interesting topic. Then we'll talk about latching also. You see, some women they don't want to breastfeed. You cannot judge anybody and you can't blame anybody. Some people maybe they did it the first time, they didn't enjoy it, and maybe they've not seen. But most time in the antenatal clinic we do discuss about breastfeeding even before the birth of the baby. And that's why I always say that as a woman that is pregnant, if you go for antenatal clinic, please ask questions. It's very important. Ask questions, so that things that you don't understand will be explained to you, and you will be on the safe side, because you've been carrying this baby for 9 months, and now it's time for you to breastfeed. You should not have any difficulty, because you would have been prepared, you know emotionally, physically, psychologically. You'll be ready to breastfeed your baby, because the truth is breast milk is still the best form of feeding, especially in the first 6 months, because it has a lot of nutrients, has a lot of advantages, and it's very cheap. If you want to buy a can of artificial milk now, that does not even have much value to your baby, very expensive. But breast milk, God has already made it. He has perfected everything. It's very good, and it protect the baby from so many infections and diseases. The first milk that comes out after delivery is known as colostrum, and this covers the baby. If you see a well breastfed baby and the baby on artificial milk, you will see the difference is always clear. But there are some reasons that may make a woman not to breastfeed, maybe sickness, so many things. I'm not here to judge anybody. The decision is yours. But as a midwife, I have the right to tell you that breast milk is still the best form of feeding that you can give your child. So this evening, I want to be talking about um, breast engorgement. It's a challenge so many women face, especially in the first few days after delivery, because she does not have much experience about breastfeeding. So when she start breastfeeding, she may find it just, in fact, I made a video, you can see it on my wall. You see, when she's breastfeeding, she'll be feeling pain as that baby is, suckling suckling on that nipple. She'll be feeling pain. So breastfeeding has its own challenges, but it's the best made for the child. So as I was saying, that breast engorgement is a common challenge many mother face, especially in the first few days, because she's a new mom. Even if she has given birth before, she must have done that maybe 2 or 3 years ago. She has weaned her baby, and now this is another baby, and the way baby suck different. In fact, our parents, like my mom, she believed that boys suckle more than girls, which could be true. So I think it's very important for me to talk about this breast engorgement. After delivery, when the milk supply is established, and this occurs when the breast is overly full of milk, blood, and other fluid, leading to swelling, firmness, and discomfort. That is what I mean by breast engorgement. In the first few weeks after delivery, the milk supply is established now, and so the breast may be overly filled up because the baby has not started sucking very well. So the breast can get full of milk, blood, and other fluids, and this could make the breast to be swollen, to be very firm, and this could be very discomfort to the new mom. If you see a woman that has gone through breast engorgement, you know that it's a very painful condition. And you see some of them will be running temperature. Anything that has to do that has to do with inflammation, there will always be low grade fever, and the patient will not be, she will not feel, the woman will not feel comfortable. So it's something that needs to be talked about. So how does it feel when you have breast engorgement? Breast may be swollen, hard, warm, and painful. In fact, some of them you can't even touch the breast. That's why you see some of them, they don't even want the baby to come near the breast because it will be swollen very firm. You see some will be shiny like this, that it's very tender, and you even still, even without touching it, you know that this breast, the way it's shining is will be very painful. And you see the nipple may be flat, and this will make latching very difficult. What do I mean by latching? That is, if you want to breastfeed, I don't have a doll baby, but I will get it one of these days. When you put your baby to breast, the mouth of the baby is supposed to cover from the areola so that the nipple will be inside the mouth of the uh baby. This is what we call latching. Not that the baby should only draw the nipple. No, the baby's mouth should cover from the areola to the nipple so that the baby will be able to suck very well, and the milk will be able to flow down the baby's throat without any discomfort to either the mother or the baby. So if the nipple is very flat, this will make that latching to be very difficult for the baby to do, because the baby will be struggling to grasp on the nipple. And that's why we used to tell them in the antenatal clinic that when you are pregnant, you should be, after bathing in the morning, you can rub Vaseline on your nipple and be pulling it out, or you ask your husband to help you suck it, so that the nipple will be very prominent. Because there are some women, naturally their nipple is flat or inverted, but when you are pulling it out before delivery, it will get better, and the baby will not have difficulty in latching on the breast. Then sometimes it is accompanied by a low grade fever. Just like I told you, anywhere there's inflammation, there's tendency for the client to have low grade fever. Because the inflammation we have is affecting the breast, but the body will react naturally, and she may have a low grade fever. So what are the simple way to manage this breast engorgement? Number one is breastfeed frequently, at least every 2 to 3 hours, to keep milk flowing. Yes, it's painful, but you can still manage. Just put the baby to the breast, let the baby suckle it. As the milk is coming out, the milk will be flowing very well, so the pain will be less, because as the baby is sucking on it and the milk is coming out, the breast will be reducing in the swelling that is already there, and you will feel much better. Let it be between every 2 to 3 hours, or you can do it on demand. If the pain is not too much, you can just put your baby, and as the baby draws the milk down, your breast will the tenderness will go down. Then ensure proper latching to help baby empty the breast effectively. Just like I said, the baby, you should the baby should come to the breast. Not that you should be doing like this. When you hold your baby like this, you allow the baby to put the mouth and cover from your areola and all the nipple. The baby you will even be hearing it as the baby is sucking. You'll be hearing as the baby is suckling, the baby is enjoying the breast milk. You as a mother, you will feel it. So the baby will be able, if there's proper latching, the baby will be able to empty the breast effectively. Because breastfeeding is a very interesting thing. As your baby is suckling, even you as a mother, you will be happy, because the baby, you will see some of them, you will be raising up their legs, looking at the mommy's eyes, because the baby is enjoying that milk, giving by the Lord to the mother, free of charge. No need to buy, no need to go and boil it, no need to go and do this or that. Breast milk is free and is very cheap, and it's food with a lot of nutrients and antibodies inside it. Then you can also express, thank God we have a lot of uh things nowadays to express your breast pump. I mean that you can express the milk, put it in a feeding bottle and keep it in a place, and you can always warm it for the baby to take. So express or pump a little milk if breast feels so full before latching. Maybe before you put your baby to the breast, you can see that the breast is very heavy and it's paining you. Please, you can just pump it to reduce that tenderness before the baby latch on it. Then you can use warm compress, you know, or take a warm shower before feeding to reduce swelling. You can get something, warm compress. You can put it on your breast. You can get a towel and make sure you just put it on your breast, because the breast is engorge now is very big and it's very painful. So just put it so that you will feel relief, or you take a shower before breastfeeding so that you will feel better, so that you feel better, in breastfeeding your baby. Then you wear a supportive bra that is not too tight. This breast is already very big, it's tender, it's painful, so you don't have to wear a very tight bra that you will not feel comfortable. I'm not breastfeeding, but I don't really like wearing bra like that. If I'm not going anywhere, I will just leave my breast when I'm at home. And as soon as I come, sometimes when I'm coming, even from the car, you see me loosening my uh bra. It's not that it's tight, but then even if the bra is of your normal size, you just feel that you are something is tight on your chest. So now that you have this case of breast engorgement, please don't wear a very tight bra. It is not comfortable and it won't be comfortable. Wear a bra that is very supportive, that you will feel very comfortable wearing it, and it will also help in lifting your breast, and it will keep the breast in place. And one thing I want you to know is that with the right care, engorgement usually improves within days. However, if swelling and pain persist, or if you develop fever and chills, maybe despite all these things that your healthcare provider ask you to do, you still feel the breast is so painful and you are always feeling feverish, please go and see your doctor or your midwife for the necessary treatment. Just like I used to tell you every time, you are the owner of your body. You know where it's paining you. You you listen to your body and you feel that this thing is off. Please go to the hospital. Don't wait till when things are very bad or complication develops before you go to the hospital. So consult with your healthcare to rule out mastitis. Remember, you are not alone. When you are going through this problem, you are never alone. Breastfeeding takes patience, support and consistency. So please don't say because you have this issue you now win your baby. No, that breast milk needs to come out. And with all these things that I told you, if you can follow it diligently, honestly, you will feel better. So that by the time you even go to the hospital, you just get one or two advice and everything will be okay. The baby needs to suckle on that breast. As much as the baby is suckling, you will feel relief. Applying warm compress and doing some of these things that make sure your baby latches very well on your breast, and you will see that within days it will resolve itself and life goes on. Nobody likes stress, nobody likes to suffer. So make sure you take very good care of yourself. Even as you are breastfeeding, anytime the baby finish breastfeeding, please get some rest, and you can take paracetamol if you are feeling pain. But just like I told you, if it persists, it's better for you to go to the hospital to go and see your doctor or your midwife for you to get treated. So let's talk about this latching. I was talking about it that some people will say, what is latching? What is latching? That's why I said, even one of my video, that as a pregnant woman, anytime you go to the hospital, either during prenatal or during postpartum, and your midwife is saying some things in medical terms, and you can ask, you can Google it, you can write it down, you can even ask her, I want to know this. What does it mean? What does latching mean? I've been hearing one woman talking about it on YouTube. I don't know what it means. And you can drop question for me and I will answer it. So why good latching is important in an effective milk remover. Honestly, if your baby latches very well, you not have problem. Your engorgement will resolve within days and everything will be fine. So latching is very important in breastfeeding. A deep latch allows the baby to suckle and massage the areola, ensuring they get enough milk from the breast. It's just because I don't have a baby, I don't have something I can just describe this latching to you. Let's say this is your baby now, and your breast, that those black those dots on it, that's what we call areola, and the nipple is at the middle. So the baby should not only hold the nipple, but the baby's mouth should cover, from the areola to the nipple will be in his mouth, and as the baby is suckling, the milk will be rushing out and you will feel relieved. I remember when I was breastfeeding, and I was working as a midwife in a general hospital in Kebbi State. I do keep my baby with my neighbor. She was my nanny. By 10 a.m., I'll come back for break to come and breastfeed her. Before I leave, before I left the hospital, my breast would have been very heavy. As soon as I remove my bra like this, if you see the way without even without me putting her on the breast, you will see the milk will be as if a tap was opened. So someone told me that we don't have big breasts, that we secrete a lot of milk. Medically, I don't know, maybe it's true, but that's what people used to say. So you see, when by the time she will suckle it, I will feel relief, because you will be feeling heavy. You'll be feeling heavy when that I wasn't having engorgement of the breast, but because the breast was full, and my baby was not close to me for her to suckle it, I will feel that my chest is heavy. As soon as she sucks very well, I will feel better, and I will feel lighter. So latching is very, very important in breastfeeding. Support milk supply. When your baby latches very well, it's it supports your milk supply, because when the baby effectively removes the milk, it signals the body to produce more, helping to regulate and support the milk supply. In everything in our body, a message need to be sent to the brain. So as soon as you put your baby to the breast, a message will be sent to your brain, and the message will say, this baby wants more milk, and the milk will be flowing. The milk will be flowing as much as it suckles it. You will not see breast never run dry, except even when you breastfeed it will take some time before the whole milk will get dry up. So as much as that baby is suckling well, this will help to regulate and support milk supply, which is very important, as much as the baby is taking that breast milk. So this also prevents nipple pain and damage, because you put your baby very well. The baby will be able, to the suckling and latching will help the nipple. We prevent nipple pain and damage. So this is very a proper latch prevents baby from only suckling on the nipples, which can cause some soreness, cracked nipples, and other injury. Just like I told you, if the baby's mouth is only on the nipple, this can make your nipple to be sore, can make your nipple to be cracked. But when the baby latches very well, no, this will prevent all those injuries on your nipple. Then it helps to reduce the risk of clogged ducts or mastitis, because the baby is suckling well, the baby is emptying the breast. There's no way the duct can be blocked, or your breast can be really inflamed, mastitis. So this latching helps a lot. So what are the signs of a good latch? Wide open mouth covering the areola, not only the nipple. I've said it so many times since I started this. The baby's mouth will cover the areola, the nipple will be in the baby's mouth, and the baby will be able, to suck very well. Chin on the breast. The baby's chin rests on your breast. The baby, this is the chin of the baby. As the baby is breastfeeding, the chin will be on your breast, and the nipple and the areola will be inside the baby's mouth. So these are the signs of good latch. You will even see. Then there won't be pain, because the baby is latching very well. You won't feel any pain. You see some people when they are breastfeeding, I even made a video about it. So that is sign of a good latch. Then audible swallowing. This, you can hear your baby swallowing. You will be hearing him, my baby is getting enough breast milk. So these are all the signs of a good latch. Latching is very important in breastfeeding, because this will help you to know that your baby is getting enough milk. So that's it for today. It's like, come again. I'll see you. Take care and God bless. Breastfeed your baby, and if your symptom persists, please go to the hospital and get treated. Thank you and God bless you.